Today, we're going to become clinical detectives. We're diving deep into the art of spleen palpation, an amazing technique that can uncover some pretty serious clues about a person's health, using nothing more than a skilled pair of hands.
So I want you to think about this for a second. What if a huge, vital clue to a serious disease was just hiding, right there in plain sight, but the only way to find it was by touch? It sounds like something straight out of a detective novel, right? Well, in the world of medicine, it happens all the time.
And the specific clue we are hunting for is the spleen. Normally, this organ is completely tucked away, hidden, and protected by the ribcage. You shouldn't be able to feel it, period. So when a clinician can feel it, that's a massive signal. It immediately becomes this critical diagnostic landmark, pointing towards a whole host of things, from infections like mono to more serious issues like portal hypertension or even blood disorders. All right, so you're the detective. Where do you even begin this investigation? Well, just like any good detective story, it all starts with setting the scene perfectly. You absolutely have to get this part right, because the whole technique is basically useless without the proper setup. And it all hinges on patient comfort. You've got to communicate clearly, make sure they have privacy and feel comfortable, get the proper exposure of the abdomen, and finally, this is key, you have to encourage them to relax. Just think about it. A tense patient means tense abdominal muscles, and that's like a brick wall hiding the very clue you're looking for. Now for your role, the examiner. First, you're always going to stand on the patient's right side. Then you instruct them to take deep breaths. But here's a little trick. Have them breathe through their mouth. It's a neat little hack that really helps relax that abdominal wall. And, of course, you're constantly talking to them, asking them to let you know if there's any pain. This isn't a one-way street. It's a partnership. And here is a crucial piece of insider info, a real clinical pearl from the experts. It sounds so simple, but it is so important. Always warm your hands. Seriously, if you put cold hands on someone's abdomen, their muscles will tense up without them even meaning to. And just like that, the trail has gone cold before you even started the search. Okay, the scene is set, the patient is relaxed, your hands are warm. Now it's time for the main event, deploying the primary method to uncover the evidence. This is the single-handed method. Now, here's the kind of counterintuitive part. You start way over in the lower right part of the abdomen, the right iliac fossa, nowhere near where the spleen actually lives. So why on earth do we do that? Well, imagine a spleen that's massively enlarged. It could actually stretch all the way across the abdomen. If you started too close to it, you might be right on top of it and miss the edge completely. So you start far away, place your hand flat, and aim your fingers up toward the left ribs. Now, the movement here is key. It's a rhythmic, ratcheting motion that syncs up perfectly with the patient's breathing. As they breathe in, your hand stays absolutely still. You're just waiting, feeling for the tip of the spleen to come down and bump against your fingers. Then, as they breathe out, that's your cue to move. You slide your hand upwards and diagonally. You just repeat this with every breath, making this slow, patient, methodical search across the abdomen. But what happens if you do all of that and nothing? The trail's gone cold. Well, any good detective has more than one tool in their bag, so let's look at some advanced techniques for those more challenging cases. First up is the bimanual method, which just means using two hands. Your left hand acts as a support. You place it behind the patient's lower left ribs and gently press forward. This little maneuver helps push the spleen forward, bringing it closer to your palpating right hand. It's almost like having an assistant on the inside, bringing the evidence right to you. If that spleen is still being elusive, it's time to change the scene. Have the patient roll over onto their right side. Now you've brought a powerful new ally into the investigation: gravity. Gravity helps the spleen fall forward and down, which also helps relax the abdominal wall and makes it that much more accessible. And for those really tough cases, the detective's kit has even more specialized tools. You've got the hooking method, where you use the curled fingers of both hands to try and hook the edge of the spleen from underneath the ribs. Then there's the enforced or Hutchinson method, which is perfect for patients with a thicker or more rigid abdominal wall. You basically use one hand to apply pressure on top of the other, giving you a deeper, more controlled palpation. Okay, but what if the clue isn't hidden by muscle, but by fluid? In a condition called tense ascites, the abdomen is full of fluid masking the organs. For this, we have the dipping method. It's a really clever move. You give a sudden, deep press with your fingertips right over where the spleen should be. This quick push displaces the fluid for just a moment. And in that moment, your fingers make brief contact with the solid organ. You can even feel it as it floats back up and gently taps against your fingers. This amazing effect is called ballottement. It's literally just pure physics being applied to solve a diagnostic mystery.
Okay, so you've used your skills, you've adapted your technique, and you've found the clue. The investigation is far from over. In fact, you could say the most important part is just beginning, cracking the case by interpreting what you've found. You see, finding the spleen is one thing. Describing it accurately is everything. This is your detective's documentation checklist. You need to note its size in centimeters below the ribs, whether it's tender, its consistency, is it soft, firm, or hard, the surface, the edge, and crucially, whether you can feel the splenic notch. This is how you turn a simple physical finding into a detailed, valuable report. But how do you know for sure that what you're feeling is the spleen and not, say, an enlarged kidney? They live in the same neighborhood after all. Well, the answer is the smoking gun of spleen palpation, the splenic notch. It's this small little indentation on its edge, and it's the single most important feature. If you can feel that notch, you can be certain you're dealing with the spleen. Case closed on that front.
And why does all this matter so much? Because a spleen that you can actually feel is almost always an enlarged spleen, often 3 times its normal size or even more. Finding one isn't the end of the story, it's the beginning. It always means something else is going on that warrants a full investigation.
And here you can see the entire investigative process we've just walked through, all laid out. It's a beautiful, logical pathway, starting with patient preparation, moving to the main technique, escalating to others if you need to, and ending with that crucial documentation. It's a clear map of clinical reasoning in action. And one last really important note on being precise, which is something every good detective values. If you go through all these steps and you don't feel the spleen, you document it as impalpable. You never, ever write not enlarged, because you simply can't rule out a smaller enlargement just by touch. Remember the old saying, the absence of evidence isn't evidence of absence.
So, to recap, mastering this art really comes down to 4 key principles. You prepare meticulously. You systematize your approach. You're ready to adapt your techniques when needed. And finally, you interpret your findings with absolute precision. That really is the core of masterful clinical detection.
And this really gets to the heart of it all, with a quote that I think just says it all. The best diagnostic tool will always be the skillful and thoughtful application of the clinician's own senses. In our modern age of high-tech imaging and labs, there is still incredible power, and yes, even art, in the simple, focused act of a human touch. And that's something worth remembering.